I'd like to request all the delegates to come onto the stage. Firstly, I would like to invite Group Captain Dr. Shankar S., a consultant rheumatologist, AFMC Pune. Dr. Jyotsna Oak, consultant rheumatologist from Mumbai. Dr. Chandrasekhar, our medical director of ChanRe. Dr. Renuka, director of the CDL. Dr. Dharmanan, director of CRICR. And Dr. Sridharan, he's administrator of IARET and the chairperson of the ethics committee, ChanRe. I would now like to call on Dr. Chandrasekhar, our medical director, to welcome the gathering.
Good morning. It's the continuing process that what we have started almost 8 years back, and this is the 8th of the update in series. And thankfully, we were with your all the supports, we were able to continue our endeavor in these updates and various other education programs. The whole process of medical practice, as I understand and as I continue to put it across, is we need to keep constantly being updated. We need to know almost every day that what next new is there to deliver it across to our patients. As for this to happen, we need to have a different platforms. We need to get different people who know more about it, and we need to go on organizing if we have a system to do, or at least to participate where it is possible to do. So since the beginning, I thought that let us have this process going on, rolling, and we could continue to do that, and we hope to continue this process on for further as long as and as far as possible. For this program, when I was looking for experts, I could figure out that we have people who are really doing a lot of jobs, and at that point of time I could really look in that the editor of our journal, who has put his effort from last year and a half in making that into a much more better shape from where he took over, is one of the best faculty whom I can have along with. And when I contacted him to be a part of as a faculty, he immediately accepted to be with us, and I can understand the pressure that he has in his command hospital and the amount of work they have as an editor and amount of other jobs. He willingly accepted to be with us, and I welcome you, sir, to be a part of it and to chair the sessions. And as our another distinguished faculty, we have Dr. Jyotsna Oak. She was formerly a professor, and I have seen her from quite some time, from the time I was a student. I have heard her speaking in various sessions and programs. And now she has moved into the, as a consultant in Kokila Behan Hospital. And she's well known, and she's one of the good organizers. I could still recollect, I think she held the post as treasurer for quite secretary for quite long time with our association. And I could understand the busy schedule and pressure she has, because I invited her to be with us a night before. She said that it's a very hard job for me to do. I do understand that in a city like Bombay, the pressure of handling the patients and pressure of handling the city per se itself is quite hectic. And in spite of that, she could make it to join us. I welcome you, madam. Our another distinguished faculty, Dr. Mahesh, whom you know, I think he has participated in one or two of us, our other sessions, and is our constant associate, especially in the management of allergy and allergy-related disease. And his organization also has been a part of us in endeavoring and continuing our research. I welcome you, sir. And of course, our colleagues and our distinguished delegates who are our continuous support in all our programs, as well as in our continued endeavor in serving the patients, and your support is almost all the time welcome, and I welcome all of you to this particular functions. Thank you very much.
Thank you, sir. We now move on to the traditional part of the function, the lighting the lamp. I request all the dignitaries to come forward. Thank you, sir. Thank you, ma'am. Next, we have the report of the ChanRe institutions by Dr. Renuka.
Our respected chief guest of honor, and Dr. Shankar, Dr. Jyotsna, all the dignitaries sitting here, and the dignitaries of the dais, all my friends. It gives me a lot of pleasure to read out this annual update for the 8th consecutive year. And we are very pleased at ChanRe to inform that ChanRe Group has grown further in this year, and the ChanRe Rheumatology Immunology Center has further strengthened its full-fledged hospital for the care of patients suffering from immunological and rheumatological disorders. We have now, as I said, we have this unit at Basveshwar Nagar Hospital, which is having a 20-bedded inpatient facility in addition to the outpatient clinic, wherein a lot of research academic activity is going on simultaneously along with the patient care. A fellowship training program has been ongoing for the last 3 years in ChanRe. And Dr. Apurva Khare, who passed out last year, is now well placed in Bhopal Medical College, where he started exclusively a rheumatology department. Dr. Arun from Bangalore, he is now doing his fellowship for the current academic year. In association with the various other centers like the Vivekananda Yoga Kendra, Yoga Association, Vyas, as well as Maharani Lakshmi Amani College, and the Indian Institute of Science, we have a few research projects which are ongoing. A lot of basic research work is also going on, which we have completed 1 project as of now, and another 4 are ongoing. The various research publications were done, and of which evaluation of serum immunoglobulin levels in bronchial asthma in association with MS Ramaya Medical College, some of the students who did from there. It has been published in the journal Lung India 2010. And another one article which has been accepted from ChanRe is evaluation of efficacy of combination of methotrexate and HCQS with leflunomide in active rheumatoid arthritis. This paper has been published in Indian Journal of Pharmacology in the year 2010. Plus, there are another few papers which are published, 2 papers which were presented in the IRACON conference. Articles have come in magazines like Sudha as well as Taranga. With all this, a lot of clinical trials have also been going on. We have 8 completed clinical trial projects, 8 which are ongoing, and a few more which has been on the pipeline. This whole clinical research work is being overseen by the Institutional Ethical Committee, which is headed by Dr. Sridharan, a very senior faculty, under his guidance, along with professionals from other fields like pharmacologists, basic scientists, biostatisticians, advocates, social worker, which are all ensured that the ethical standards are maintained before they take up any trial. With all these activities, again, ChanRe Diagnostic Lab has also been progressing. This year, ChanRe Diagnostic Lab, I'm very proud to say that we are now an NABL accredited lab. We have got an NABL certification, for which my team has worked very well, and I would really like to thank them for all the hard work which they have put in, especially our quality manager, Lakshmi, our technical managers, and all the lab staff who have worked for the last few months or a year, wherein they have been working hard for getting the accreditation. Besides, we have been upgrading our lab as far as both the softwares are concerned as well as the lab tests, which are being reviewed, and continuously there is an ongoing process of upgradation which is happening at the diagnostic lab. A specialty polyclinic has been started with various fields at the Malaysian unit, and of which the recently started ChanRe Dental Clinic has taken roots, and we are able to cater dental problems of these cases. This was all possible because of the support of clinicians which was associated with us, like the pulmonology department, the obstetrics, gynecology, pediatrics, and we further expect that we get further support from them, and are likely to enlarge the specialty clinic further. The Nagaratna Srikanta Paramedical College, this work has, the college has been doing fine. The students are mainly lab technology and X-ray technician students have been taken in. But now, though we are having only a diploma course, we are thinking of further going in for degree courses in this particular field. In addition to that, a lot of community service programs have been going on, CMEs have been going on. From the lab side, we have conducted, in association with Interlab Quality Assurance Bangalore, we have conducted an immunofluorescence diagnostic workshop in this year. And there were a lot of other lectures and talks given by our faculty at various events, various sessions, CMEs. Sometimes health talks were public function talks were given. And a lot of activities, community camps have been held, free camps have been held in this current year. So in this way, we have been trying our best to put in our best foot forward and go work hard over towards getting a goal of getting a completely integrated, center with all kinds of activities like, say, research, basic research, as well along with the patient clinical care and education to the people. So we just hope that you will all be with us in this particular effort. I know this has all been possible with the sincere support from all the clinicians which are there who are associated with us. Thank you so much.
Thank you, ma'am. Next, we have another report from the IARET, which is the Immunology, Arthritis Research and Education Trust. And this will be given by Dr. Sridharan. He's the administrator of IARET and the chairperson of the ethics committee. Formerly a chief microbiologist, he was a professor in MS Ramaya Medical College. So,
thank you for the introduction. So, the trust, Immunology, Arthritis Research and Education Trust, is in existence for the past 10 years, and if you note, it is even before ChanRe Rheumatology Immunology Center or CDL started, this trust was started. So this is the brainchild of Dr. Chandrasekhara well supported and nourished by Dr. Dharmanand, Dr. Renuka and Dr. Raghavendra Rao. He is a yoga specialist. This was started in 2000 and the primary objectives set by the trustees were as follows: education of patients and general community regarding arthritis, rheumatology and rheumatology, so as to bring more awareness to both the patients and the community. Second objective was to initiate, support and associate with interested groups for concerted academic research in this field of rheumatology and immunology. Third objective was to find ways and means of supporting poor patients get proper expert advice and treatment free or at least on a subsidized cost. The trust, though through CRI, CR and CDL, has achieved a great deal in fulfilling these objectives in the past decade. So I am trying to give you a brief outline of what we have done in the last 10 years of our existence and what we are trying to go ahead and do in the future years ahead. Though it started very slowly as any other organization, we are proud to say that CRI, CR and CDL has brought out many booklets in English and Kannada for patients' awareness, as also periodic quarterly publications for updating the current knowledge and practice in rheumatology and immunology for family physicians. So these publications are circulated among many of our primary physicians who are in our loop and available for circulation. Few of the publications in the earlier publications are available for interested groups. Also, our expert and outside faculty have delivered lectures in different forms. We have conducted many CMEs and workshops on different aspects of rheumatology and immunology for interested groups like primary physicians, corporate doctors, postgraduate students, laboratory consultants and technologists, etc. You can find a list of all these publications and activities in our souvenir, which is already distributed to you. Regarding the second objective of research, as you can see, there is a long list of our endeavor regarding the research that is in-house at CRI, CR itself and CDL itself, research associated with other organizations like Indian Institute of Science, Maharani Lakshmi Ammani College, and involvement in global multicentric clinical trial also. The details of these are also published in our souvenir in a complete list of all our activities are printed there. Regarding the third and most important objective of helping the poor patients get proper treatment at substantially lessened burden, CRI, CR and CDL through the efforts of the trust have taken many initiatives. Over the past few years, we were able to identify genuinely needy poor patients and extend them free or subsidized billing for both diagnosis and treatment in our both the centers. Recently, we have started a drug bank for issuing free drugs to the needy patients. In this regard, I make an earnest appeal to all the concerned to extend their support for these activities by way of cash donation, drug donation and dedicated support for these activities. Coming to the next new development which has happened in the current year, the trust has initiated a new move. This is to recognize and also in the process initiate increased academic interest in taking up the study of rheumatology and immunology by postgraduate students. We have decided to award Certificate of Excellence and Certificate of Merit to recently passed out postgraduates for their dissertation or thesis. We have sent invitation to many of the departments in majority of the medical institutes all over South India. We were able to receive a few submissions and among them a few were referred to an expert review group for recommendations. One academic work has been selected for the award of Certificate of Merit with a cash prize. This particular work abstract is displayed outside for all of you to go through that, and the author is also here if you need to discuss with him. The trust is happy to give this award in the ChanRe Update 2010 function and would like to continue this initiative in the years to come. Ending this report of the ChanRe of the Immunology, Arthritis Research and Education Trust, I now request Dr. Chandrasekhar as Managing Trustee to say a few words regarding the institution of this new award and also to announce the recipient of this award for the year 2010. Thank you.
Good evening. Good morning. I think there is the basic issue why we instituted this particular program was we were just trying to wonder how to stimulate the postgraduates to get into the rheumatology. I think this is a discussion even IRA is trying to initiate, and IRA has its program, so I thought we will have also some innovative way of getting the postgraduates into this fold. I was also feeling sometime when I was a postgraduate, and I think probably most of us would have also felt so when we are doing postgraduates. Why are we really doing a thesis? Because in the end game, we sometimes feel that we have been made to do and go through some sort of a mandatory process of collecting some information, putting it across, making it a pack of papers, and submitting it through, and then the university says it's okay, and we finish MD, and then we forget that as a chapter. So actually what I thought is, see, when someone is trying to choose some area of working, whether it is a cardiology or a rheumatology or whatever it is, so there would be some inclination for which he might have chosen that particular subject. So if we find out that if he has done some work and if we just figure out that yes, this is something which you have done good, probably that pact may push him further to jump into that field. And that was the thought process what I put across, and when I discussed with our other senior members and senior colleagues, they said yes, probably that should help. And that was one of the reasons why I took this step to initiate, to identify the students, postgraduate students who have done a thesis in rheumatology and immunology, and to identify which has been done to the best among them in that year and to give it. So we took it to do it after the pass out because of the obligations, because unless the university approves that particular thesis, we have no right to say yes or no on that particular thesis, because we cannot override the superiority of the university. So university, after it approves, it has agreed it as a thesis, and once he pass out, that's the time when we start, we will recognize, identify that particular thesis, and try to make them motivate to think that there is still more future in the field of rheumatology. And that was another reason we thought we start working towards that. And of course, we decide little late in the course of event, because we decided a little late, around maybe around October or so, we decided, and we circulated little late in the course. Probably that's why the response might have been little poor this time. We are hoping to get bit better response next time, so that we start this particular campaigning from the very beginning. We were planning to start somewhere in April, May, the time when they start looking for the exam and submission. And we institute a cash prize of around 5,000 for this, and a certificate awarded as a certificate of excellence, and also give them a platform to present their particular thesis and work, so that people do read about it and try to understand what next best can be done with reference to this. This time we could identify Dr. Rajesh's thesis, who did his thesis in Bangalore Medical College under the aegis guidance of Professor Dr. Vasant Kamath. We invited her, I think she was busy with her other programs. And he has done on the concept of neurological involvement in rheumatoid arthritis, try to figure out and identify that quite a bit of rheumatoid arthritis patients do have an early neurological deficit, and we need to figure it out and find it. And I call upon Dr. Rajesh to accept this prize. Thank you very much.
Thank you, sir, and congratulations to all our directors. We're very proud of the achievements and hope to do more, sir, under your able guidance. Now, I'd like to request Dr. Jyotsna to release our souvenir. Can we have the souvenir, please? Ma'am? Thank you, ma'am. All of you do have a copy of the souvenir, I suppose, and if you don't have one, please collect it at the registration desk. Next, I would like to request Group Captain Dr. Shankar S. to say a few words and address the gathering.
First of all, I think that's a surprise. I was not told by Dr. Chandrasekhar that I'll have to speak. But I know I have been attending this ChanRe update. I was earlier posted at Hospital, Bangalore, and I have attended a few of the earlier updates. And I was always impressed with the excellent choice of topics which Dr. Chandrasekhar and Dr. Rainuka had used to generate. So now I'm in Pune. I'm very glad that you called me here because my parents also happen to be in Bangalore. So I'm extremely happy that I was able to come here. I noticed that the topics have been chosen to be very clinical, and hopefully by the end of it, he has also not kept it very cluttered, which is again an excellent part of an update, because normally when you have 15 to 20 topics, then it's really a race against time. I noticed that just by keeping 6 to 8, and also more importantly, I'm told that there is a whole set of case discussions in the afternoon. And again, he threw a surprise on me by saying he didn't tell us what the case was. So we are supposed to give our expert judgment spontaneously, which I think it's actually the correct way it should be done, rather than, a pre-prepared scenario. So I think at the end of the day, in any update, it's science that matters. And I think Dr. Chandrasekhar has really chosen his scientific topics and its presentation well. And I wish him all the best. Thank you very much.
Sorry to pull the surprise on you, sir, but the excellent orator you are, you did justice. Thank you, sir. I would now request Dr. Dharmanand to give the vote of thanks.
Good afternoon. My sincere thanks to all the delegates who have come despite being a Sunday. And also my sincere thanks to the chairpersons, Dr. Anupama and Dr. Uma had graciously agreed to our request. And my thanks to Dr. Jyotsna and Dr. Shankar for agreeing to be the expert speakers today. And my sincere thanks. A meeting of this magnitude is not possible without our sponsors. I thank all the sponsors, the pharmaceutical industry, who has helped us to arrange this meeting. And my thanks goes to API Bhavan for this wonderful auditorium. And I will be failing in my duty if I don't thank the staff of ChanRe and CDL for their untiring work towards making this meeting a success. And also my thanks to audiovisual people who are contributing to making the CME into a long-term CD, so that people who have not attended also should be able to see this program in future. And thanks to caterers and one and all if I have missed anybody. Thank you very much for patience.